Now, is the new Cass report really so horrific? Well, there was a statement made yesterday in the House of Commons by the Secretary of State for Health and Social Care, Victoria Atkins, where she began by addressing the Deputy Speaker and expressed gratitude for the presence of parents affected by the issues discussed in the Cass review of gender identity services for children and young people, and emphasised the need for sensitivity and the ensuing debate. Yeah, unbelievably, from this government. But anyway, the statement she read highlighted a significant surge in referrals to gender identity clinics over the past decade, particularly amongst adolescent girls, suggesting that this increase is not coincidental but driven by factors such as prevailing myths that changing gender is the solution to adolescents' feelings of unease or distress about their identity. Yeah, this is really where we are now. The Health Secretary then acknowledged the comprehensive review conducted by Dr Hilary Cass, commissioned by NHS England to examine these issues, and commend Dr Cass's thoroughness and courage in addressing a contentious area of healthcare. She then went on to say that important changes have been made since the interim report, including the closure of the Tavistock Clinic and the establishment of new regional hubs. Additionally, NHS England has ceased routine prescription of puberty blockers to children and will review clinical policy for cross-sex hormones. Measures are being taken to ensure compliance with regulations and standards, including warnings to private providers and engagement with regulatory bodies like the Care Quality Commission and the General Medical Council. Concerns were raised about the lack of robust data on the long-term outcomes for children treated by gender identity services, as well as the refusal of some clinics to cooperate with research efforts. Dr Cass's findings suggest a need for a deeper understanding of the cultural and digital influences on young women's perceptions of gender. Then Victoria Atkins concluded by affirming a commitment to compassionate and evidence-based healthcare for children, pledging to address harmful ideologies, support those affected by previous treatments, and ensure the well-being of future generations. So basically, the Health Secretary expressed a firm stance against practices that may compromise the safety and well-being of children, while advocating for a more thoughtful and holistic approach to gender identity healthcare. Confidence in the proposed measures is conveyed through the government's decisive actions and commitment to ongoing improvement. But what did Shadow Secretary of State Wes Streeting say? Well, he began by expressing gratitude to the Secretary of State and Dr Hilary Cass and her team for their thorough and thoughtful work on the Cass review of gender identity services for children and young people, then commended Dr Cass's academic rigour and highlight the role of journalists like Hannah Barnes and whistleblowers in bringing attention to issues at the Tavistock Clinic. He then acknowledged the complexity of the issue, recognising both positive and negative experiences of individuals who have undergone gender-affirming medical pathways, and emphasised the urgency of getting healthcare right for children and young people, referring to gender identity services. Then Streeting described the findings of the Cass review as scandalous, citing long waiting times for care, shaky evidence for medical interventions and lack of cooperation from some NHS providers, stressing the importance of approaching the discussion with care and sensitivity, particularly due to the vulnerability of the children and young people involved. He then said concerns were raised about lengthy waiting lists, lack of mental health support and workforce shortage within NHS services, where Streeting highlighted the need for personal and holistic care and seeks clarification on plans to review waiting times and establish follow-through services up to the age of 25. He then went on to say the decision to stop routine prescription of puberty blockers by NHS England is welcomed, but concerns about potential loopholes for private providers were mentioned. Streeting then asked about plans for further regulation to ensure compliance with recommendations. Also, the refusal of adult gender services to share patient data was criticised and accountability for this was questioned. Wes Streeting called for the Cass report to be a turning point for gender identity services in the NHS and for societal and political discourse on the issue. He then went on to advocate for collaboration across political lines to prioritise the healthcare of vulnerable children, acknowledging the role of the Right Honourable Member for Bromsgrove, Sajid Javid, in commissioning the review and expressing a willingness to work constructively with the Health Secretary. Well, Victoria Atkins welcomed those who have reconsidered their stance on the issue at hand and emphasised the importance of facing uncomfortable truths to move forward with recommendations put forth by Dr. Cass. Then got snotty with Wes Streeting, urging him to acknowledge the role his previous ideology played in contributing to the problem and causing hurt to others. She then questioned whether he understands the impact of his past statements, particularly regarding dismissing concerns and labelling discussions as culture wars, then called for an apology for those who have been unfairly maligned, including female colleagues, and highlighting the chilling effects of clinicians, journalists and campaigners who tried to raise awareness. Then smugly expressed hope that he genuinely intends to change his approach on the issue, stressing the need for a fresh start for the sake of the affected children, young people and their families who live with the consequences of past actions and attitudes. Couldn't make it up, could you? A Tory party that spends God knows how long stoking culture wars, accusing the opposition of starting culture wars practically. Well, SNP spokesperson Kirsten Oswald began by emphasising the importance of respecting individuals' identities and avoiding the polarisation of such matters. She then quoted Dr. Cass's report highlighting the detrimental effects of polarisation on young people seeking care and on research efforts. Oswald stressed the need for respectful discussion and the importance of allowing clinicians, rather than politicians, to make decisions regarding healthcare treatments. She then clarified that Dr. Cass's report does not aim to challenge trans identities or limit access to healthcare, but rather to improve gender identity healthcare for all individuals, including children and young people. She then questioned whether additional funding will be allocated to ensure that young trans individuals can access quality healthcare. Finally, Oswald inquired about the government's plans regarding the banning of conversion practices, referencing the government's commitment to consider the recommendations of the Cass review in drafting legislation. She then sought an update on how the review will influence legislative proposals and when these proposals will be published. Well, Victoria Atkins encouraged the SNP in Scotland and Labour in Wales to promptly respond to the findings of the review, then clarified that the allocation of funds for clinics in England is not additional money, but rather a reprioritised within NHS budgets, urging the SNP to prioritise the needs of children and young people in their regions similarly. Ain't she a saint, Atkins then suggested that the atmosphere of the debate has been negatively impacted by the SNP's Hate Crime and Public Order Act 2021 in Scotland, then pointed to behaviours on social media and suggests that naming activists has had consequences. Additionally, she questioned why the Scottish Labour Party supported the passage of this act, implying that it contributed to the atmosphere surrounding the debate. Unbelievable. Now, when it comes to the Cass report, I don't really know enough of this subject to really have a serious opinion, but I've heard quite a few people who are from the trans community are feeling quite scared about this, and hearing the Secretary of Health believing that there's a prevailing myth that changing gender is the solution to adolescents' feelings of unease or distress about their identity. I think young people are far more intelligent than that Victoria Atkins. Also, I get the feeling that what Wes Streeting said didn't help either. But what do you guys think? Let me know down below and I shall bid you farewell and take care, my friends.